Hi everyone, in today's video we shall be comparing PCOS, polycystic ovary syndrome, and endometriosis. In other words, you will be learning the differences and similarities between these two conditions. You're welcome back to my channel. I'm Dr. Sylvia, a general practitioner and health educator and the founder of AskAwayHealth. We enjoy talking about everything to do with women's health and family health, sexual and reproductive health care, everything that you need to know to help you live better. We are here for you. First, what are these conditions? Let's start with PCOS, polycystic ovary syndrome. It's a condition that, you guessed it, affects women's ovaries. And in this case, the ovaries contain multiple abnormal cysts, which end up disrupting ovulation, menstruation, and fertility. PCOS happens from hormone imbalance. Women with PCOS have higher than normal levels of male hormones or androgens, for example, testosterone. PCOS is also linked with a higher level of insulin in the blood, as women with PCOS can develop insulin resistance, so they cannot regulate insulin properly. This leads to developing type 2 diabetes mellitus. With all that said, we don't know the exact cause of PCOS. What about endometriosis? This is a condition where tissue that is similar to the womb lining exists outside the womb. So this could be in the ovaries or the fallopian tube or elsewhere in the body. We also don't know the cause of endometriosis, but there are several theories, and if you want to learn more about them, please go and check out these videos in my channel, and I'm going to put the links in the description box for you as well. Let's go on with the comparison. Now let's look at symptoms. First, what is similar between these two conditions? Well, not very much, apart from the fact that they occur in women, of course. You can get irregular periods in both conditions. Periods can be frequent, they can be heavy or scanty, they can be prolonged. All manner of things can happen to the periods. Many women will not have a typical monthly cycle if they have either of these conditions. Secondly, they can create a serious challenge with fertility and make it difficult or more challenging for a woman to get pregnant if she has PCOS or endometriosis. And what about the differences? Women with PCOS may have the following symptoms. Excess weight is a frequent feature, infrequent and scanty periods, excess hair growth, which is also known as hirsutism. They may lose their hair or have thinner hair or thinning hair. They suffer with skin problems like acne, and they have fertility problems that develop because of ovulation failure or because they are simply not ovulating. And what about endometriosis? Well, these are the symptoms that you're more likely to find in a woman who has endometriosis. Heavy bleeding and painful periods tend to be more likely. They can have pelvic pain, back pain, pain during sexual intercourse, pain during their periods when they're opening their bowels or going to toilet to pass urine. They can suffer from anemia because of excess blood loss. Fertility can result because of damage to their organs from scarring thanks to endometriosis tissue. This can affect the ovaries directly or the tubes and other parts of the womb. Endometriosis is generally not linked with any weight associations, and we haven't noticed an increased level of hormones like insulin in women with endometriosis. Now let's look at the treatments, because that's important. Do they have the same type of treatments? It's always important to establish the diagnosis so that you can have the right treatment to quickly address and treat the problem. Both PCOS and endometriosis are chronic conditions that many women will live with till they reach menopause and even beyond. For some, hormone changes around menopause may affect their symptoms. So this time, let's start with endometriosis. We believe that the growth of endometriosis tissues and cysts is largely under the influence of hormones, particularly estrogen. Unfortunately, there is no cure for endometriosis, but there are treatments which usually address a woman's most pressing problems. For example, fertility or heavy periods or painful periods and so on. Some of these treatments try to prevent menstruation. For example, they mimic a situation where a woman is pregnant or going through the menopause, and this hopefully removes the effect of the hormones on the womb's tissue. But as I said, even after menopause, some women may still struggle with endometriosis and require treatment. It tells us that there's really more to it than just estrogen. So treatment options for endometriosis: number one, hormones to regulate bleeding and painful periods. For example, the combined birth control pill. And of course, this needs to be carefully monitored because while it might help bleeding for some women, in others it could make things worse. Second, another option is to suppress the estrogen hormone and make those endometriosis tissues or patches inactive. Doing so with other forms of birth control like the Mirena coil or the depot shot, the depot progesterone injection. 3, there are other hormone-like medicines that can modify the behavior of those endometriosis tissues and reduce the impact of the symptoms. 4, surgery is another option to remove abnormally sited or located tissue from different parts of the body. 5, a woman who has fertility problems with endometriosis may require IVF. This depends on the stage or type of the disease. And 6, lifestyle measures are also necessary when you're treating endometriosis. Some studies suggest that eating lots of red meat, being overweight, and exposure to certain chemicals can increase the risk of developing endometriosis or endometriosis tissue growing. While a diet that is rich in fruits and vegetable, omega-3 acids, for example, are protective factors against developing endometriosis. And now let's take a look at treatment for PCOS. Again, PCOS treatments will address particular symptoms and fertility issues. We do not have a cure for this condition. Since it is associated with diabetes, a lot of focus is on preventing women with PCOS from going ahead to develop type 2 diabetes and other heart-related or cardiovascular complications. Number 1, treatments can include hormone options like the pill to regulate a cycle. Number 2, ovulation drugs or treatments are useful to boost ovulation. 3, lifestyle measures are also important in PCOS. Take a look at this video where I talked about natural options for treating PCOS. Weight loss, if necessary, is important. Regular exercise, a healthy, low carbohydrate diet that is low in processed food, rich in plant-based rather than animal-based food. Number 4, surgical options to restore ovulation include procedures like laparoscopic ovarian drilling. While 5, IVF is another option for women with PCOS if any of those measures do not work. Thanks for watching this video comparing PCOS and endometriosis. I hope it helps to clarify both conditions a little bit better in your mind so you can quickly see where they are similar and where they are different. Let me know what you think in the comment section below. Check out these 2 videos here and here. If you want to learn more about these conditions, please don't forget to like the video and subscribe to the channel, and I will see you in the comments.